Another 10% goes to pharmaceutical companies and prescriptions, 7% nursing homes. So the bulk of the expenditure is going towards the hospital care. So we have to focus on reducing hospital care. And as we already discussed earlier, cutting down hospital care is through preventing admissions and readmissions of the same patient, whether it's from the outpatient setting or from a nursing home. Hospitals have to bundle up payments, and the other things that can be done, patients, if they have insurance, they can follow a primary medical doctor and not get admitted again and again for serious problems. If you take a scenario, if a patient is having high blood pressure, he gets admitted through the emergency room, he's discharged in a few days with medications. If he doesn't have a primary medical doctor, he ends up next visit in the ER with a stroke, and he's treated in the intensive care, then he might be sent to rehab for rehabilitation, which is a lot amount of tax dollars. So all this money adds up. But if he had insurance, either through the government or private, whichever the plan is going to be, this could be all prevented. Same goes with a diabetic patient, with anybody with heart disease. It applies to all primary diseases. So if somebody has insurance, these things can be avoided and the healthcare expenditure can be cut off.
But this plan is addressing some of those issues because of the uninsured as well as the donut hole that you talk about. So then when I look at the things that Dr. Singh mentioned, you know, that it's going to cover the uninsured, it's going to cover you for pre-existing conditions and some of these things, it seems that there is an agreement. So where is the pushback? Where would the disagreements be from your perspective? I mean, if you were to mention one or 2 points.
The major disagreement, I think, is the defense of medicine that we're doing. No matter who is covered, you know, if you do not approach and address the tort reform, the whole process is lost. It is unbelievable how at this stage of the game nothing is mentioned about tort reform.
So that's the one issue.
A major criteria.
That I understand from talking to all the physicians. So that's one. Is there anything else that would be not palatable to the physician community because it's going to impact you, which indirectly or directly is going to impact the patients that you treat?
If they are going to fund this partly from reducing payments for Medicare patients, you're going to find difficulty having a lot of good doctors wanting to participate with Medicare.
The other thing is the shortage of doctors. They are predicting, the AMA, that there is going to be a 20% shortage of doctors. So if 45 million people come into the system and physicians not accepting Medicaid at this time, and in certain areas of Florida and so on, physicians are reluctant to accept Medicare patients as well. So where are they going to find the doctors to provide health care to everyone?
But that's more issue of, you know, the number of people that get recruited into the system more than basically a policy decision on the health reform bill. Dr. Wimmer, you work with a lot of the elderly patients, and obviously, you know, the AARP has been pretty front and center on this, and there have been a lot of talk about death panels and end of life. Can you just address briefly what is the end of life issue that keeps coming up?
End of life is those few days, and it could last for a number of years, when a person is on the way of passing on. And it is really important for us to address this so that every patient would make plans for themselves as to what they want to do with their lives. If they want to be in a hospital setting, if they want to die at home, if they want to be with hospice, if they want any treatments done, if they don't want any treatments done, this should be the patient's right to make decisions. And oftentimes they do not want many of these things done to them.
Mm-hmm.
But is there anything in the bill that kind of impinges on the rights of the patients, is what I'm asking you? This current reform bill that we're seeing.
It doesn't address it as much as it should. And I think Dr. Singh mentioned a very good point that maybe when one person starts getting their Medicare, that everybody at that time, they need to make decisions about, their end of life situation, whether they want to be resuscitated or not, and how they would like to be treated, whether they want humongous amounts of tests done or not. And this will really impact on the amount of dollars that we're spending on the end of life care situation.
One of the other things that we have picked up across the board is that, physicians who are really, let's say, in the specialty areas, they are a lot more concerned about this bill because of the Medicare reimbursements and things of that nature. Can someone here address that? Because when we've talked to a group of cardiologists, etc., they said this is going to have a bigger impact now. That might be true or false, but any views on that?
I think that whatever little I've read, they're talking about reducing payments more so to specialists compared to primary care. And I think it's a shame because really they go through extra training to be specialists. And there are great doctors in the area that are taking retirement or, and quit practice of medicine and going into FDA, because you really have to take into account the amount of energy, the resources that it takes to become a doctor, a primary care, and then